Thank you, Sarah. That was tremendous. We really appreciate it. I'd like to welcome Sherry King to the podium to introduce our next panel.
Thank you. I suspect people are just hungry and want to make sure we get to lunch on time. The AC's Family Support Network was established in 2007 and has been comprised of autism resource specialists embedded at our 5 clinical sites. Those include Boston Children's Hospital, Boston Medical Center, the Lurie Family Autism Center, UMass, and Tufts Medical Centers. Our team of resource specialists, perhaps more affectionately known as the ARSs, have served nearly 10,000 families in that time and taken on thousands of clinician requests. In clinic, an ARS is often the first person a family sees when a diagnosis is made. He or she goes on to support them as they navigate the often complex and overwhelming maze of seeking services and support, with the ultimate goal of realizing each child's full potential. Like our esteemed colleagues here of clinicians, researchers, community partners, and funders, our team of ARSs have been trailblazers, catalyzing our knowledge and working to rapidly advance our progress in the form of information we procure and pass on, and in the connections we help to facilitate. The ARS team has successfully created and maintained an extensive online resource database, collectively authored a Transition to Adulthood manual, parent information packet translated into multiple languages, all available on the table outside, by the way, and created dozens of resource handouts, patient materials, blog posts, news articles, parent and professional trainings and workshops, and the list goes on. And it's my personal bias that this team is made up of some of the kindest, most empathetic, most resourceful and thoughtful professionals on the block, who never lose focus on the real reason that we're all here, to support the lives of our children and families. It's my pleasure now to introduce our panelists for today, Ann Neumeyer of the Lurie Family Autism Center, ARSs Neal, Goodman, and Kelly Hurley of UMass and Boston Children's Hospital, respectively, Jeremy Young, parent and advocate, and Joshua Lyons of Till Inc., moderated by Marilyn Augustyn of Boston Medical Center, to share their perspective today. Thank you very much.
Good morning. It's really a pleasure to moderate this panel, and not to add the thanks of our prior speakers, but on behalf of Boston Medical Center, I do want to thank the Autism Consortium, and I think it's reflected in the title of this session, which I love. Our panel is titled Enhancing Clinical Care with Critical Resources, and I think that's really what we at Boston Medical Center have really come to feel about the Family Support Network and the Autism Consortium, is that recognition that family support is as critical as everything else that we do around supporting families and children with autism. So thank you again to the consortium. And I don't know if I'd call these people actually the dobutamine of autism treatment, but I think they are really going to talk this morning about how critical what the autism resource specialists do and how we can effectively support families. So without any further ado, maybe Kelly, if you'd be willing to take our first question, could you sort of operationalize for us, if you will, the role of the autism resource specialist in clinic on a daily basis? What does it look like? What do you do for those people who don't have the pleasure of working with ARSs?
Okay. Well, I can tell you that no 2 days are ever the same. It's difficult to know what to expect. I started my position at UMass approximately 8.5 years ago. And at that time, I was mostly meeting with children who were just receiving the diagnosis. So much has changed since then. Back then, there were occasions when families would come in and they had no idea that their child was being evaluated for an autism diagnosis. Today, for the most part, we have families who come in and they suspect that their child may be given a diagnosis. And one of the areas that can be difficult when working with families are for those who come in looking for an ADHD evaluation, and they know that there are some red flags, but they never thought that it would amount to autism. So I think the role of ARS is really to listen to those families, There's so much uncertainty around autism. How is it diagnosed? What treatment should we put into place? How are we going to access these supports? How come some people can get supports with private insurance and other people can't? So I think that the biggest thing that we can do for families is try to understand where are they in the process, where can we meet them, let's listen to their concerns, and the wonderful thing is that we have clinicians who help guide us, and we have amazing community service agencies who are there to partner with us. So by collaborating, I feel like we're able to give parents the necessary information that they need to get the services to support their child in the home, in the school, and in the community. And so for me, a typical day at UMass, at the Center for Autism and Neurodevelopmental Disorders, there are multiple clinics going on. So there could be an anxiety clinic, a neurology clinic, an ADHD clinic. There's an interdisciplinary clinic, so I can receive referrals from there. And some days I feel like I'm just in a revolving door. But there's nothing better than to meet with a family and to have ample resources to help them. But once again, it's, I guess the phrase that I would like to use is that I'm looking at the caregiver capacity. I don't want to overwhelm the parent, but I want the parent to understand that there are so many more supports and services available than when my children were diagnosed 15 years ago. And so I want them to understand the strengths and weaknesses of their child, to be able to leave the clinic, to be able to go home and tell their spouse or their family and friends the wonderful skills that their child have, but also that there are other things that we can do to help, say, their expressive language. So I want them to be encouraged. So I can also receive referrals outside of the Center for Autism and Neurodevelopmental Disorders. I receive referrals from Pediatrics, from pulmonary. I have no idea where I'm going to get my next phone call. I also receive referrals from people in the school system, from community service agencies. I receive referrals from families who have a neighbor who has a sister who was just diagnosed and they're looking for answers. And the wonderful thing is that even though it's nice to be able to meet with a family face to face, I can still get this information from families who are so eager to share and help support their children. So.
Excellent, thank you. Neal, I know from the work that I've done with our autism resource specialists, in addition to what happens in the clinic, there's an awful lot of other work that goes on. Maybe could you sort of speak to what other things, responsibilities are part of being an autism resource specialist?
Sure. And it does vary depending on the hospital or institution you're working in. And I should just very briefly piggyback off of what Kelly was saying. A good percentage of my work is following up with families once they are meeting with their clinician and the clinical team is making various recommendations. I deal with a very, very wide range of requests for helping families find appropriate resources. I also am responsible for following up with every child newly diagnosed with autism in the center, as I think all the resource specialists are. And then in addition to that, I do a wide range of other things. For example, I oversee the email messaging service that we have in the Developmental Medicine Center. It's a messaging platform for families that have kids newly diagnosed with autism, but also maybe who have been diagnosed for some time. The program typically works where you get an email once a week for half a year, and then it tapers off to every other week. It is an opportunity to learn about local resources. It's an opportunity to hear about some of the latest research on autism. We send a lot of email blasts, and it's also a number of families contact me through the email message system with various questions, usually resource related, that I assist with. I'm also very involved with one of the most exciting initiatives at Children's. We have launched the Autism Spectrum Center, and I have been actively involved in the various planning meetings. And one of the things that's really beautiful about at least my experience participating in the Spectrum Center initiative, is that we don't just help families navigate the existing world of resources. With the Autism Spectrum Center, I have a chance to create new resources. Just one very quick example is we have been creating a mobile app to assist families, of course, with children on the spectrum, to become better prepared for their hospital visits. We have basically children's stories with images and easy to understand text that outline step by step the various medical procedures that they might be scheduled to go to. And the parent can read that story with their child. It's a way of previewing the medical procedure. And so we've been going through various iterations of that product. That's just one example. And there's many more. I could go on and on, but that's at least a snapshot.
Excellent. Thank you, Neal. And from a clinician perspective, what are the ways that you and your team at the Lurie Center work with your autism resource specialists to improve or change patient care?
Well, the first thing I want to say is that we don't run down to their office and knock on the door, because until a couple days ago, I didn't even know they had a door. It's always open. And they are always there to help us with our patients. And that's very important for the clinician who's trying to manage a lot of patients. So what I see that the ARS team does is they really facilitate communication for us between the clinician and the family. So that might mean that they help the family digest the information that we've presented to them with a new diagnosis, by calling them up a couple days later, or it might be that they're checking in a lot later, or that they're there for families to call and get support, as Kelly has already talked about. So facilitating communication is very important. Patient support is also very important, as Kelly discussed. And then the other thing is the resource specialists have an incredible fund of knowledge about all the resources in the community, which is really helpful for me. So when I'm looking for a dentist for my patient who admits that they haven't ever had the courage to take their child to a dentist, I can go down to Suzanne Bloomer and say, Suzanne, I need some dentists for this family, and she'll gather the information and talk to the family about, based on where they live, who would be appropriate, and give them choices. They also help gather information for us. So if I need to get some information about what's going on in the school system or in the daycare, I can ask Suzanne, and she will happily get information about what's going on with the school so that I have more information to make diagnostic opinions. So communication, patient support, and their knowledge base are really important to us. Thank you.
I just want to add from my own, I was just at the American Academy of Pediatrics meetings in California last week, and I always forget, except when I'm at a national meeting, how different my practice is compared to the rest of the country. And sometimes I think about life as sort of before Sherry and after Sherry, and it's kind of like childbirth, but I can hardly remember before Sherry, and I don't think I want to, similar to labor. So I think that it changes the way that you practice, and you become so enmeshed in the team approach to families that I just don't even want to imagine life. I don't even think about life after Sherry or not having the autism resource specialist, because I really can't imagine practicing without one anymore. So I agree with everything that you said, Anne. Jeremy, your perspective, critically important as a parent of 4 children on the autism spectrum. What's been important to you about the support that you've received from Tufts?
Sure. I'd like to expand on that we aren't just at Tufts. We've been at Children's, MGH. I think we've covered at some point most of the Autism Consortium. We typically try to find specialists at each location, whatever works. But specifically about the ARS, the 2 specialists that I've dealt with most are Bernadette and Julie. I believe Julie's moved on to older individuals, and now Suzanne. But initially when we started, I remember it's clear as day, Bernadette came in, we had I think it was our 2 oldest kids at the time, and it was for our second son being diagnosed, and she sort of said, there's not much I can do for you as far as knowledge or information. You're pretty well versed in all of this. We had communicated before, but she gave me her card and her information, and so began our relationship. And I think no matter where a parent is in their experience or knowledge, to keep those lines of communication open, Bernadette and I have emailed back and forth on various topics, one of which was me requesting funding resources for a training that was for professionals that I wanted to attend as a parent for feeding, and she was able to connect me with a resource here in Massachusetts that covers up to $500 of that cost. Sometimes it can be the emotional, just being able to dish about a particular provider, your experience, and sort of say, okay, I've gone through this person, now I'd like to go to somebody else who I think would be a better fit for our family, and being able to just unload without having that issue of professional courtesy with they can just sort of take it and not have to. A lot of physicians will not say anything and don't want to refer in contradiction to their peers. And resource information, I think the push-pull, I've been asked at times to provide information on what I know about autism and sometimes my perspective. And to me, that has been as uplifting as getting information, is feeling that I'm a valued participant and that I have something to offer back to the community. And certainly one of the biggest pushes I got from Bernadette and Julie, to give Julie credit, is they both told me that I should become an advocate. And by doing that, I think it has been a great thing for my family and for myself, but also for the lives that I've been able to touch through that work that I do. And I believe strongly that no child should be without information or access to services. And I think the more people that we can get out to and share that knowledge, as the autism resource specialists do, the better our children will do. And also, neurotypical children tend to do better by their exposure to children with disabilities. So I think that's important.
Excellent, thank you. I think you may have addressed how you empowered yourself, and I congratulate you on becoming an advocate. That's incredibly important work. Can you speak to perhaps if there is one biggest challenge or one of the things that most challenged you or your family in the treatment of your children over the years?
I would say clinicians are the biggest challenge I've ever faced. Sorry to all of you out there. But honestly, our oldest had a low APGAR score when he was born. He didn't receive his diagnosis till he was 27 months. My wife and I identified him at 6 months old as having issues. And that was probably the biggest struggle, having physicians tell us, your child's normal, he'll catch up, don't worry about it. I myself didn't receive a diagnosis till I was a month from turning 30. On the autism spectrum, my mother had been told when I was a child that it was her fault and all the normal things that you hear. So the biggest problem, I think, is getting the proper diagnosis, and not just autism. Some of the comorbid conditions, as have been discussed, can be really difficult in this group of individuals, just because of how there's a lot of overlap, or there may be different difficulty in collecting information about the children and being able to get proper responses, and tying into resources or getting to the right clinician. And that's possibly why we're so spread out, is when you find the right person, you latch onto them and you do everything you can to get in to see those clinicians. We see Dr. Bowie at the Lurie Center, and we had to pull a lot of strings to be able to get in to see him. And we have a unique situation with our oldest two are fraternal twins through IVF. So that was how we got in to see him. He was piqued by that. So whatever it takes to get in to see a clinician, no matter how long their waiting list is, I would say to any parent and to the clinicians, these parents, oftentimes, you may be the first time that they're seeing someone who knows what they're talking about. And I've met some clinicians, and I know Bernadette and I talk often about my favorite list and the people I refer to who are now leaving or have left Tufts. And those that I would absolutely say do not go to, because I think some of them have some social issues as well. But so that's my biggest challenge, I think.
Thank you. Thanks, Jeremy. I appreciate your candor. And I think you're spot on, so I think it's an important message to hear. And I think you bring up a very common frustration that families have. Sometimes we forget in Massachusetts where we have the capacity to even have something like an autism consortium. And I speak to colleagues in Arkansas and Montana where there may be one clinician. So thank you for that critical reminder. And along that vein, Kelly and Neal, you have a wealth of years between you in serving and supporting families. And I'm wondering if through those years you've seen common themes of struggles that either we have or haven't made progress on, or that seem to keep coming. Probably the top might be the one Jeremy alluded to, being access and specific clinicians. But any other common themes that you see come up?
Well, I will mention, Jeremy, that I also have my favorite list of clinicians and service providers, which is based on feedback from families. And as people who I work with at UMass know, sometimes I will make the reference that these are family favorites. I couldn't tell you if these clinicians really do a great job with the services they provide, but the families seem to like them. So when I think about how we work together, and we have clinicians and service providers and the families, it's very important for us to make sure that we're all interconnected. But the one barrier that comes up to me that really puts a kink in service delivery is insurance. For the families who have private insurance, they can get Common Health. There's a limited enrollment period for families who have Mass Health to get private insurance. But there are some families who have private health insurance where it's very difficult for them to access home ABA services. And in a way, I feel like there's still some discrimination that takes place for families. And I think that there needs to be a better way for families to be able to access the same services. So since insurance is so important to service delivery, that is a big one for me.
Yeah, insurance is definitely a big driver. I think as far as the broader themes, I mean, I've assisted families who have kids not just with autism spectrum issues, but a broad range of intellectual and developmental disabilities. And again, there is the resource scarcity issue and then resource complexity issues. And so, in addition to getting families the right information, which is actually it's no small task to get the right information, but even beyond that, it's helping families develop helpful strategies to find what they need. I think that the way one looks for resources becomes just as important as what resources you're looking for. And sometimes, I think of the family, actually, I think it was one of Dr. Rappaport's patients who the family had been calling 66 different therapists, and none of them took the child's insurance, or they just weren't accepting new patients. And I would applaud the parents' tenacity, but one of the reasons that may have been happening is she may not have realized that maybe she wasn't using the right strategies. There may have been questions about the insurance or maybe other avenues to explore. So I see these questions all the time in my work. These themes come up over and over. It seems to be getting tougher sometimes with the budget cutbacks, but I think knowledge is power and strategies go a long way.
Excellent, thank you. I think we're all waiting with bated breath for the outcome of the Autism Omnibus Bill, and when it's actually written and put in practical terms for January, I hope some of the struggles that you've seen so long may change, but I think the devil will all be in the details, unfortunately. Now that we know Josh's mic is working, Josh, why don't we go to you as the coordinator of the Boston Autism Support Center, Project Hill. I know I've had incredible opportunity to hear and learn about the work you've done with the Family Support Network, but I'm not sure that everyone in our audience has heard about that tight partnership. So maybe could you speak a little bit to how you've partnered with the Family Support Network?
Of course. Yes, it does work. I'm loud anyway, so I'll try to speak quietly. So the thing that we really believe in mostly is that really what Jeremy was saying, that parents are one another's greatest resource. And so over the past 3 years, we've really tried to develop opportunities for parents to get to know one another. And what we found was when I first started at Till about 3 years ago, we had one family support group in the city of Boston. And I thought, what the heck are we doing? How do we have one family support group? And what we realized, what I learned very quickly being here, was that folks who live in Cambridge are not going to come to Dorchester. And folks that live in Watertown are not going to go to Chelsea. And so we had to do some grassroots stuff and start neighborhood groups in the actual neighborhoods. And I'm happy to say that right now we have 14 Till neighborhood groups going strong. We have Vietnamese, Chinese, Spanish-speaking, English-speaking, all of these groups are going, and so we really felt it was super important, and it would provide such great help for these folks to get together and talk about their experiences, share resources. So that is definitely the first thing we always try to encourage folks. Get plugged into some type of networking system. The second thing we do is we are thankfully funded by the Department of Developmental Services, and they give us a nice operating budget to work within, and we can offer community services for free. I would say 95% of the things we offer are completely free. Every now and again we might have to charge a $5 copay or something like that, but regardless of one's socioeconomic status or where they might fall, they can come and participate in this stuff. And even if there's a copay, tell your families, tell all of your families, even if there's a copay, call Josh and say, we can't afford that. We let them in, okay? So anybody is welcome to come to that stuff. Some of the greatest things that we've had the chance to do since I've been here at Till is we've partnered greatly with Boston Medical Center and their autism program. And you mentioned a minute ago Life Before Sherry. I wouldn't know what to do without Sherry. She has been such a tremendous resource to the folks in Boston, the families we serve. And together we have been able to start several social skills groups. We had a group called Teen Talk that developed into a social group that the kids came together twice a month. They hung out. It turned into something that they were doing on their own. We kind of set them free and let them do that. That was really exciting. Sherry and Lauren both have been huge partners for our community outings, for our vacation and holiday events. And I think that the greatest thing that we've done recently, I would say, is we got this idea of family matchmaking, taking a parent who has navigated the system, much like yourself, Jeremy, someone who knows what they're talking about, and they've gone through that hard stuff, and we put them with a parent who just received a diagnosis, and someone who feels anxious, someone who is uncertain of how to proceed. And we, as I mentioned before, families help families in a way that I as a professional can't. They understand one another in a way that I can't. And I think that the greatest thing we can do as professionals is hook those up with some really solid families. And so they're walking together, they're learning things, and I think we're just seeing that if we can come together, we can show these families they're not alone. There is an entire community here to help them and to walk with them through this really difficult thing.
Excellent, thank you. I wish that we had all the CFOs of the teaching hospitals that are going to be making decisions in the coming years about support to the Family Support Network in the audience, but I think we're taping this, so maybe we can play it, get it somehow rigged into their iPhone so they have to watch it on the subway in the morning. But first maybe Kelly and Neal, but then perhaps the whole panel. Why do we need a Family Support Network? What makes it important to the families we serve?
We really fill so many critical gaps. When I think about the number of patients that are seen in these clinics and some of the supports that these families are looking for, it just makes more sense for us to sit with these patients and find out what their needs are and help support them. Once again, our mission is to empower these families. It's not to be a personal assistant. As we hear from Jeremy, not only has he been able to find ways to support his own family, he is now working with other families. Josh has mentioned the same thing. When the Autism Consortium talks about the numbers of families whom we are supporting, it doesn't take into account the ripple effect from the parents who have been supported who are now helping other families. When it comes to parent education, I have a parent support group that meets in Worcester. It's open to the public. There are people who are working with DCF to get their children back. There are other people in those groups who can help those families. As Josh mentioned, I don't have experience at that level. So we need to connect these families with other people who are familiar with what's going on. I received a referral from the anxiety clinic for a child who has autism and selective mutism. I also received a referral from child psychiatry for a child who has autism and selective mutism. I was able to bring those two parents together. At the CANDO Center, Dr. Kadlik is very good about helping me fill these gaps. So in regards to the insurance, I've been able to work out a system for families who need help navigating getting supplemental insurance rather than waiting 2 hours to get seen by a financial counselor. We now have the capacity to make appointments and allow these families to come in and get their needs met. As far as respite goes, we are now working with an agency called Horace Mann Educational Associates, the Central Mass Housing Respite Coalition, Assumption College, to train college students to help families who need a break. These are some of the needs that are out there, and I think what the ARS role does is it allows us to build relationships not only with the clinicians who are making the referrals, but also the community service agencies and the parents. And that interconnected bond and relationships that inform and support each other, I think that's where our strength is making sure we understand the needs and we know how to fill those critical gaps.
Excellent. Neal?
I guess that's the million-dollar question, right? Why is it so essential? I'm reminded of, and as I mentioned previously, I follow up with every family that has a newly diagnosed child with autism in the Developmental Medicine Center, and it's always a privilege to talk with every family. And the question I hear over and over again, I mean, one of the purposes of my following up is we like to make sure that they have all their questions answered, and of course, trying to orient them to resources. They almost never have a question about the diagnosis or the recommendations. I hear glowing praise about the state-of-the-art developmental evaluation process that Children's uses. Everything is very clear, the recommendations are very compelling, but they usually say, well, we're really not sure what to do now. Where do we go? Where do we find these? Where do we find these behavioral therapy? Who do we talk to? How is it supposed to work with early intervention or school? So I think, in a nutshell, the Family Support Network, all the resource specialists, we help complete the process of care. At the end of the day, you can have state-of-the-art diagnoses and clinical recommendations, but our role is to really help the families operationalize the recommendations, follow through, and implement them. And that's where we orient them to resources. We give them concrete contact information. We help them with strategies. And this is, of course, a critical gap between the science side, the medical, clinical diagnoses, and then the practical implementation side. So that's why we're essential.
Any panelists want to add anything for the CFOs in the audience of why we need a family support network?
I'd just like to say, although it's sort of a tangent from that, but I think it'll give a good example. Our oldest was diagnosed at 27 months with autism. Our youngest, our daughter, who's 5 now, was diagnosed provisionally at 10, 11 months and then reconfirmed at Tufts at 12 months. So the difference in that gap of 15 months has made a tremendous difference, and being able to access those resources earlier So as knowledgeable as I was at the time that our son got the diagnosis, I became even more knowledgeable through the resource specialists, through the information I was able to access, and the various programs through the Federation, the PCTI that I was pushed towards by Julie and Bernadette. So that sort of importance is to be able to say that there is an effect. I can say within my own family there's been an effect, and I know that for other families that there is an effect, and hopefully it'll reach beyond just inside the clinics, but also out to general physicians and other practices to sort of give them the resources. I like the resources coming out about autism and being able to provide those, and I share those with our general physician, and every time I go in, she sort of says, well, you know more about this than I do. I said, but I want you to know as much as I do, so that when another child comes through, you can say, you know what, this looks like this child, I'm gonna refer them now, they're 6 months old, they may not be able to diagnose, but they can be followed, and they get the proper care and treatment earlier. And as we all know, the earlier you can get to a child with treatment, no matter what the condition, the better the outcome for them. So.
Excellent, thank you. And how would you say the presence or the teamwork with the autism resource specialist has impacted your clinical practice? Has it changed things for you, or?
So I think one of the key words here is empowerment, that the resource team really helps to empower the clinician. And it may surprise you to hear this, but it's kind of like what Marilyn was saying about going through labor before you had a resource specialist, that a lot of physicians don't want to care for children with autism because they don't feel empowered to do anything, and they don't know how to help the families. And having a resource specialist working with you as a team really allows the physician to feel like they can help the family through the resource specialist, because the resource specialist, as you've heard, really helps to operationalize all of those recommendations that we make. And similarly, it really helps the family to feel empowered. So I think it improves the satisfaction of our day-to-day jobs as clinicians, but I think it also really improves the lives of the families of the patients that we care for.
Excellent, thank you. I guess I'll close with my last favorite question that I always ask kids I'm seeing clinically, and it's always the most fun for me, but also sometimes helps me the most with the diagnosis. I always ask kids if they had 3 wishes, what would they wish for? And I won't share my absolute favorites, but I've gotten everything from a new Ferrari to a new front door to a bed, so it runs the spectrum. But we know that the family network support system is so well-tuned, and it is a machine, and it really does have such a strong wealth of resources behind it. But I don't know if we can ever say we're at perfection. So if I could give you, and I'll only give each of you one wish, because I know people, I hear grumbling stomachs. So if you had one wish for what you would wish the Family Support Network could do, or do differently, or an enhanced capacity you wish they had, what would you wish for?
More money.
I get that one a lot,
yeah, right?
actually.
Not for myself. I mean, I would take it, but I think that if I could get calls and say, yeah, we have funding for that. You know, you don't have to worry about it. Don't worry about if you have the right insurance or the wrong insurance. You know, we can help you with this no matter what. So I think if I could have one wish, it would be that we got some amazing amount of money from someplace that we could put towards all of these things that we're talking about.
Excellent. Thank you.
I'd like to see the, I think it was a couple of years ago, a shortened version of the ASD testing for children, similar to the MCHAT, but much more accurate. I believe it was 95% accurate to the current rates. Be trained for in the general physician's hands, trained and with the proper resources that they need, whether that be ARSs or ties to ARSs that they can go back to. I know I've seen more and more physicians' offices tying to major hospitals. I'd like to see some of that come back through those relationships. where the general physicians are being better properly trained in diagnosing disorders that, when diagnosed earlier, can get children into early intervention or other services quicker.
Excellent.
I just, I guess I just wish for increasing awareness of just the critical nature of resources in the work that we do. I think actually us resource specialists are not always, the nature of the work we do is not always that well understood. I think that the world of resources is kind of a jungle. I think people are struggling to make sense out of how it all works. Many of the programs, actually most of them, don't even advertise. The only reason that I know how different programs work is through just hard-earned experience. And I would like there to be a greater clarity and just much more readily available, useful information for people, and just a general greater awareness of just the utterly critical role of resources and the positive roles that all of us, and particularly the resource specialists, can play in that.
My wish would be that there would be representatives from insurance companies here today, because that's where I think this position should be funded by. Not only for the humanitarian reason of supporting children and their families and understanding the long-term benefits of supporting them, but cost-wise, we put these families in touch with resources and agencies that provide free services. And it's mind-boggling to me why this hasn't been more thought out, because I would think insurance companies would be very interested in saving money.
So my wish is more bodies. I think the resource specialist model is very useful out in the community as well. Not just having resource specialists in the autism centers, but in the community, in the pediatrician's office, would be very, very useful for families.
Excellent. Oh, sure. Now we're opening it to the audience. So if you have any questions, perfect segue. Excellent. I hope everyone could hear that. Autism resource specialists are better than Google, and that really they are the people who really support families. So I really thank you for your words. Any other questions for our panel? If people feel comfortable or able to come to the microphone, or else I'm happy to try to repeat the question for any member of the panel, or a wonderful comment. Yes, ma'am. Excellent. The question is, how does one become an autism resource specialist? If you're a parent, as Jeremy, and you want to take on becoming an advocate more specific than an autism resource specialist, or what kind of prior training?
Sure, great question. Thanks for asking that. Hopefully we have lots of you out there that want to help us. So if you would be interested, right now, as far as I know, the only place that a program like PLAN is running is here in Boston. So if you live around us and you want to help us out with that, you can contact myself, you can contact Sherry King, and Lauren is somewhere around here. She might be at the table. The three of us can definitely tell you, we would talk to you about it, we would tell you kind of what the position looks like, what the hours we would need from you, what kind of commitment it would be. We would talk to you kind of about what your areas of expertise are. We have some of our PLAN parents that are brilliant with IEP meetings. We have others that are awesome with behaviors. We have others that are just tremendous they just know every resource. They seem to know every resource ever. And so we would talk to you about that and figure out where to plug you in. Also, you know, if you don't live in Boston, come talk to us. There's always, I mean, the big, amazing thing about this would be, how cool would it be if we started this at every, you know, all 7 autism support centers around the Commonwealth? That would be awesome. We've never discussed that, Sherry. Sorry if I am pulling that one over on you. But I think that would be amazing to start something like this everywhere. But yeah, we'd love to talk to you. I'll be around after this, so please come say hi.
Any other questions? Yes, ma'am.
Hi, thank you all. I thought it was a great panel. But I'm a mom of a kid with autism, and I just want to say thank you, because when our daughter was diagnosed, you know, we got the prescription from the physician, and we had the suspicions before she was diagnosed. But if Neal hadn't called me to give me the information, I probably would not have called a resource specialist. So having you guys integrated with the physician's office at the point of diagnosis, I think is absolutely critical to getting us the information we need to get our kids the help they need early. So thank you.
Thank you.
That's beautiful music to my ears. Thank you.
Okay, then I want to thank our panelists for all their comments and their candor. Thank you all for your attention. I believe, I don't know if there are logistics for lunch, so thank you all.
I just want to add my thanks to Marilyn and to all of our panelists. You guys are unbelievable. Thank you so much. Your perspectives are just invaluable for all of us every day. I wanted to say that the ARS team, I forgot to mention this earlier, was nominated for an award called the Schwartz Award for Compassionate Care. Surely you can see by this interaction this morning that that's exactly what they do every day, and we're so grateful for all of that. So with that, I want to tell you that it's time for lunch, and the lunch is out here, and please visit the resource fair. The research tables will welcome you and tell you about their studies, and the posters are on the 2nd floor, and please be back in this room by 1:20 for our final panel on translational challenges and rewards. Thanks.